Good morning. Good evening, sir. Good evening, dear participants. Today we are here for the fifth session of National Webinar on Newborn Care of Nurses in collaboration with ECHO. I'm glad to invite today's speaker, resource person, for explaining the topic thermoregulation and management of hypothermia in newborn. Dr. Dhanraj Babu, Professor, Bharati Vidyapeeth College of Nursing, Sangli. Presently, sir is working as a professor in child health nursing department. Overall, he's having 20 years of experience in clinical nursing administration and research. He graduated and post-graduated from Bharati Vidyapeeth deemed to be University, Pune. Sir has received his PhD in nursing from Malvanjal University, Indore, Madhya Pradesh. Sir has completed his certificate training course in palliative care and in maternal and child nutrition. So, is a BIOS member for University Bharati Vidyapeeth, Secretary for Institutional Research Cell and Institutional Ethical Committee. He has so many paper presentations, scientific paper presentation at national conference on his credit, published research papers in national and international index journals, organized and attended various national and international webinars, seminars, etc. Served as a resource person in workshops, seminars, and other educational programs. He has guided more than 20 plus UG and PG thesis. He's a trainer for IMNCA, mental health in COVID-19, NTCR in 2019, and GCP trainer and ICMR guideline on biomedical ethics trainer. He's a life member of TNI and NRSA, SOMI, and CNRS Research Society. His achievements including Best Teacher Award by Global Foundation for Nursing Profession and Social Services from Jaipur in 2023. He received the Best Educator Award from EDOC's Research Center. And Sir has received Best Paper Presentation Award in National Level Pediatric Conference and winner of Best Research Paper, which is organized by Pediatric Association of India. First prize in slogan competitions and awardee for Associate Professor and got for the valuable contribution for nursing profession. I welcome you, sir, for today's session on thermoregulation and management of hypothermia in newborn. And thank you for accepting your invitation, sir.
Thank you so much, ma'am. Good afternoon, ma'am, and good afternoon, everyone here. And I'm really glad to have to be present as a resource person to my own institute where I was working since 15 years at Bharati Vidyapeeth College of Nursing.
And we're happy to see you, sir.
To the part of I am here at Sangli. Yes, ma'am. And thank you, the principal, ma'am, and the Department of Child and Nursing to invite me as a resource person. I'm very glad. Yeah. So we can start the session as we have to close, complete the task. I'm sharing the slide, ma'am.
Yes, sir.
Good afternoon, everyone. As we know, many of the newborns are born in the hospital scenario, or they are born in the various PHC, and sometimes they're born at the home. But the very important things we are lacking is that the trained nurses or the trained ASHA workers or the persons who know how to manage the newborns. There are various sessions, there are various in national organizations, they had said that how to take care of the newborns while taking the condition the delivery. But now when the mother goes to the process of she goes to the process of delivery, the baby is born. before the baby borns, the baby is in the womb of the mother, and it is a very safest uh, place where the newborn is growing. And when he delivers, he comes to the outside the world. Inside the womb, the environment is very pleasant for that newborn, who has covering with the liquor. And when we swimming, we can feel better. The baby is nicely in 9 months, is in within the liquor, that's amniotic fluid. And when now is born, he's facing the stressful environment in the NICU, or maybe the labor ward, maybe the PNC, and wherever the newborn is going to go and survive. So this newborn faces a very important phenomena, that is he's corresponding to the, and he is the child is the newborn is facing the environment. This environment may be the temperature of this environment should be very important for the newborn, because before, if the baby's temperature is less than 36.5, the baby may go into hypothermia. And with this, if the baby is not treated at the time, the baby go into her major, and there can be a mortality and morbidity. To this session, we're going to see the topic today is thermoregulation and management of hypothermia in newborn. Nurses plays a very vital role in preventing the hypothermia, as neonatal hypothermia is a very critical conditions which is characterized by the low body temperature, less than 36.5 degrees centigrade in newborns, and it is a very significant risk to the health and well-being of this newborn. As a nurse, we have to see that the first hours and the days of the newborn's lives are very critical, for as the child's develop, as he's adjusting to the outside world. As I told you, is surviving outside the womb, and he is making himself to adjust with the temperature. And if the temperature is below, the child may go into hypothermia, and we have to see the temperature should be maintained very, and we are going to see various phenomena and the mechanism how that heat is lost, or how the heat is prevented. Now, the thermoregulation is ability to maintain the balance between the heat production. Now, how, as I told, the body's temperature should be maintained normal, and this maintenance of the balance is between the heat production by the newborn and the heat loss. Okay, we are going to see there are four mechanisms, four ways how the heat is lost. And to maintain this balance, the body will maintain that body temperature within this normal. If the heat is produced properly and there is no heat loss, the baby's, the newborn's temperature will be maintained within the normal range. Hypothermia is also is a very serious metabolic consequences, as the child goes into various consequences, like the child's involves the liver, the metabolic, the brain, the kidneys, and all the very consequences are there because of the baby. Because of this hypothermia, baby go into acidosis. To minimize these effects, an environmental temperature at which the newborn has minimal rates of oxygen consumption and expend the least energy to maintain its temperature is needed. This is known as the thermoneural environment. The thermoneural environment is very much important. So with these introductions, we can go to the objectives of this today's session. We are going to see the defined hypothermia by WHO. We are going to see the levels of hypothermia: mild, moderate, and severe. We can see the very the dangerous signs of neonatal hypothermia, its consequences, its causes, risk factors. We're going to see why the newborns are more prone to hypothermia. There are two phenomena where they are more prone to get the hypothermia. How we are going to diagnose with a touch, with the three ways we are going to see how the as a nurses can diagnose, and how we are going to manage the various preventions aspect of hypothermia, and we're going to see the treatment from mild, moderate, and severe hypothermia, how it can be prevented, and how we are going to make we can follow the various strategies at um, labor room. We are going to see how we are going to maintain the hypothermia when the baby is transport. And then we are going to highlight the importance of maintaining the optimal body temperature for the overall health of the newborn. With these objectives, let us see that how what is called the prevalence. The prevalence is in a developing country it is 23%, whereas the main association is with the prematurity, low birth weight baby, lack of thermal protection at birth. The prevalence of hypothermia in premature baby is particularly high with 80%. Some suggests has suggested that 10 to 20% of neonates admitted may have a hypothermia on admission, though this can vary. So this prevalence list is little bit high, and it's more common in the premature, and in a developing countries the deaths are contributing the related to hypothermia is 23%. Now let us see the definition. Thermoregulation is the maintenance of temperature in a healthy range. The healthy range is that 36 to 37. That does not stress the body metabolism. Now, hypothermia is a no in a newborn is defined as the auxiliary temperature, which is less than 36.5 degrees. We are seeing the 36.5 to 36.7 is the thermoregulation is maintained normal, but less than 36.5 degrees centigrade is mentioned as low temperature, and that's called as a hypothermia in the newborn. The WHO defines the neonatal hypothermia as an auxiliary temperature which is below 36 degrees centigrade or 97.7 degree Fahrenheit among the newborns aged below 38 days of the, that is newborn, that is from birth to 28 days. If the temperature is below 36.5 centigrade, it is considered as hypothermia. So with this definition, we'll see there are three ways that level of the thermometer. When we check the temperature, if the temperature falls between 35 to 36.5, it is a mild hypothermia. If it is lies between 32 to 35, it is moderate, and less than 32 is a severe hypothermia. So the core body temperature of the baby should be more than 35 degree centigrade. Hypothermia is a very emergency conditions, and during the emergencies we should be rewarm the baby. Like we are going to see the steps how we are going to maintain the warmth of the babies, how we are going to conduct the deliveries in the future in the next slides. This hypothermia occurs throughout the world, even in the warm climates also. The hypothermia occurs because the environmental factors is the important factor which contribute, which is the main causes of hypothermia in the newborn. Especially when see the difference in night and day, even there is no rule that if, the hypothermia can have happen because day there is a sunlight. Even during the sunlight also hypothermia can happen. The degrees as we discussed, 36 to 36.5 is a mild, 32 to 35.9 is a moderate hypothermia, and below 32 degrees centigrade is a severe hypothermia. So let us see what is called a neutral thermal environment. The range of a environmental temperature in which a unit can maintain a normal body temperature with a minimal basal metabolic rate and least oxygen consumption. So if the hypothermia, the basal metabolic rate is increased. So if you are keeping the normal temperature, there will be minimal basal temperature and there will be less oxygen consumption. So as a nurse, we have to take care that the temperature in the environment should be maintained. That is 25 degrees centigrade in the room temperature in the delivery room we should mention. So it should not be less than 25 degree centigrade. So this is the slide which is again says that below 32 is a severe hypothermia, 32 to 36 is a moderate, and 36 to 36.5 is a mild, and this is a normal range is 36.5 to 37.5 is a normal range, and above 37 till 40 is a hypothermia. So this is the body temperature and how the neutral thermal environmentals we have to mention that is the temperature should be more than 36.5 and it should be between the range 36.5 to 37.5 centigrade. What are the risks? They are very prone to get the hypothermia. The first is the most important is a premature baby. The premature neonates have undergone the thermoregulation mechanism, which has significantly higher risk in the thermal because there is a less brown tissue or there is a less subcutaneous fat, and that's the reason the premature baby are more prone to get. The babies whose weight is less than 2.5 kg are more susceptible to get the hypothermia, and inadequate thermal protection is the insufficient heating in a delivery room. If there is no appropriate management of the heating of the room, and which is failure to initiate skin to skin, we see that the baby after the delivery it should be next to the mother, so there should be skin to skin in touch should be there. So if it is not taking place, the birth it can contribute towards the hypothermia. The cold environment, the environment where the babies are delivered, if there is a too cold or lack of proper warming during the transportation, or it is very much increasing in the area where the delivery is conducted at the rural area, at some are under reserved areas where there is no facilities of warming. So at this area the cold environments can contribute towards the risk factors for this hypothermia. Now the causes, there are various causes like environmental causes, exposure to cold weather. Now neonates, especially those who are born in a colder environment, climates are during the months, during the winter months, are more prone to get the hypothermia. Inadequate thermal protection at birth. Now baby who are not properly dried, they should be dried after the delivery with the pre-warmed linen. They should be dried properly, or they should be placed under the radiant warmth. If it is inadequate protection is there, that baby can go into a hypothermia. Low birth weight baby and premature baby are more prone because they have reduced inability to maintain the neutral body temperature, and because they have less fats and they are more susceptible to and they have a larger surface area, and that's the reason they are more prone to get the hypothermia. Cold delivery room. As I say, the delivery room should be or the NICU unit should be preheated, or it should be up to the more 25 degrees centigrade. If it is not there, if it is less than that, then there are more chance to the baby can get the hypothermia. Now there should be good transport facilities. We are going to see how we are going to manage the transport during the if the babies with the to prevent hypothermia. If there should be good transport facilities, and this transport, if there is no inadequate thermal protection kit, okay, during the transport, then the baby can get prone to get the hypothermia. So these are the environmental causes which can lead to hypothermia, that is exposure to cold weather during the cold seasons, inadequate thermal protection at birth, low birth weight baby and prematurity baby, cold delivery room, and transport to healthcare facilities. Now we can see the other causes is a physiological causes. The physiological causes are prematurity and low birth weight baby. Now, as I said, these babies are having get a ability to shiver more. They have a less subcutaneous fats. The reduced in subcutaneous fat also can lead to hypothermia, because they can't store more heat in the body, and they are likely to develop the hypothermia. The impaired thermoregulation. Why we are saying that there is an impaired thermoregulation? Because neonates have immature hypothalamic regulation body temperature, which makes it difficult the babies to adopt the environment. Okay, so this in impaired thermoregulations can take place. Now, the babies who are getting infection or sepsis, they are also they are can lead to hypothermia, as sepsis affects the maintain the temperature of the newborn, and because of this sepsis, the temperature drops in a core temperature drops down. Then hypoglycemia, if the blood sugar level goes to less than 40 degree, 40 decibel per mg, then the sugar level is goes down. The premature baby is stressed to hypothermia. This can happen because the heat through the metabolic process takes place, and there's a deficiency in the ability to regulate the temperature if the sugar level is not maintained in the body. Then inadequate nutrition, because poor baby who's having hypothermia, they are poor sucking is there, the muscles are weak, the sucking the babies can't take doesn't take breastfeeding properly, and because the temperature makes them difficult in breathing. So inadequate nutrition also can lead to the hypothermia. The other contributing factors are delayed initial care. So if we are saying that the like resuscitation is taking place, and we are not taking the baby into the radiant warmer, there is no provision of skin to skin, there is no uh, there are no adequate facilities of warming the room, then there can be a babies can go into a hypothermia. Now, mechanical ventilation or oxygen therapy is very much important, because the oxygen consumption is decreased. If it is not there in the typical areas, then it can contribute to hypothermia. Then exposure to wet surface or clothing. So when the babies are delivered, it is filled with the amniotic. If it with the wet, we are drying with a pre-warm linen. Now if it is the cloth is wet, we should change that wet cloth, and we have to use the again we have to use the warm cloth to dry the baby. So these are the various causes which which says that the babies can go into the hypothermia. So the causes are environmental causes, the physiological causes, and other contributing factors that causes the hypothermia in the newborn. Now, why newborns are prone to hypothermia? As I said, the baby is large surface area. The head is larger than the trunk and the extremities, and especially the head is larger. In the low birth weight of preterm baby, the head is large and the body is thin. Whereby the body is thin, even the skin is very thin. There is no subcutaneous fats, or there is decrease in the brown fats. That's the reason they are more prone to get the hypothermia. There is a limited heat generating mechanism and reduce subcutaneous fats in the body. And as these babies are very much vulnerable to exposure, like they are delivered on the table, they are put on the radiant warmer, also in the incubators, so they are more they are put into the NIS, they are kept into NICU where the temperature is very low. So they're vulnerable to exposure. These babies are very vulnerable to exposure to the temperature that is less than within the normal level. So they are more prone to get the hypothermia. And as we discussed, low birth weight are also very much prone to get the hypothermia. So this is the why the babies are getting, because the surface area, because reducing the subcutaneous fat, and they are more exposure into the environment, and that's the reason they get the hypothermia. So are you getting with me? So why these babies are getting? We have just seen the definition. We have seen why the babies, and we have seen the levels of hypothermia. Okay, mild, moderate, and severe. And now we are seeing that we are going to go to the next slide, how we are going to measure the temperature. So there is a three ways we are going to check the temperature. We're going to check the temperature with the back of your hand of a caregiver, at the hands and feet, at the abdomen of the skin of the baby. That's a touch method. So with a touch with your back of the hand of the caregivers, they can touch and they can feel where the temperature of the babies, that can touch at the feet of the newborn, neonate feet, hands, and abdomen skin. The abdominal temperature is closely represent the core temperature. That's the reason we're keeping the probe at the abdomen area. So mostly we have to check the abdomen temperature, because this is the area where it is a core temperature. So that we have to done by the uh, touch method. We have to can check the temperature by the auxiliary. We can check that with the help of the thermometer, auxiliary thermometer. We can record for 3 minutes. It's recommended for routine monitoring. And measure of the rectal temperatures. Most situations we avoid to take the rectal thermometer. The basic, we check the through the auxiliary thermometer. We can where the area we can show how I can show that how the temperature is taken. So this is the way how the temperature is taken. I'll show in the next slide. Uh, See, this is the slide which says that how the temperature to be taken. Okay, we should avoid rectal temperature. Even if we to take in some conditions, we have to give proper position to the baby, and this way we can check the thermometer. So this is the way where we can check the, and we have to check for the 3 minutes. And most time in the conditions we can avoid the rectal temperature. Now, how we can diagnose the hypothermia as I told human touch. So, if the uh, trunk and extremity is warm, then the interpretation is normal. If the trunk is warm and the extremity is cold, then it is called as a cold stress. And if trunk and extremities both are cold, then it can lead to a hypothermia. So by the human touch, we can diagnose how the baby is getting the hypothermia. If both trunk and extremities both are cold, then it leads to hypothermia. What is cold stress? If the trunk is warm and both the extremities are cold, then it is called the cold stress. And if the trunk and the extremities both are warm, then it is called the normal temperature. Okay, so this is the how we can diagnose. There is another third way we can check the temperature by the thermistor probe, which is mostly seen in the we can say the radiant warmer in the NICUs. It records the skin temperature available in radiant warmer and incubator in the NICUs. It should be touched on the skin over the upper abdomen. So these are the various ways that we can check the temperature of the baby. Okay, so this is how we can place the thermometer. We should not keep the thermometer in this way. This is the wrong way. We have to keep into the parallel of the to the chest wall of the baby. So parallel to the floor, we have to check the temperature. This is the right way. We have to check the temperature of the baby. No, so this is the normal range what we can say we had seen. So many 3 times I'm repeating. So the normal range is between the 36 to 37. Cold stage is between 36 to 35, and below 30, between 30 to 36 is the moderate, and less than 32 centigrade is a severe. And if the cold stage is occurs, we can see the what is the cause of hypothermia, and we have to treat the cause. in the moderate hypothermia, we have to be alert. It's a danger, and we have to start warming the baby. And if there's severe hypothermia, we have to see the cause root, and we have to take a skilled persons can take the care, and we have to take the urgently. We have to take the care to the patients, and we have to give the care for the severe hypothermia. So these are the various ways we can check. Yes. Now, why newborns are more? I had seen, and we have seen that okay, why the babies are more vulnerable for hypothermia. Now, why they are more prone to get a hypothermia? That is because of the heat loss and heat production. Now, uh, the heat loss mechanism. So the heat loss is that less subcutaneous fat. If you just see in this picture, the subcutaneous fat is less in the low birth baby and premature baby. The skins are very thin. We can see the bony prominence. There is no subcutaneous fat, and subcutaneous fat helps to produce heat, and it is very good for the babies. And in the term babies, the subcutaneous fats are very developed after the third trimester. The subcutaneous fats develop, and if the baby is born a premature born, the subcutaneous fats are not developed. They are more prone to get the hypothalamus. That's a heat loss, because the heat losses gets due to less subcutaneous fats, larger body area, more skin is exposed, and skin is very thin in the premature and low birth baby. And because of the thin skin, the blood vessels areas closer to skin surface, and the baby can lose the heat because of the skin is very thin in the this babies. The thermal balance, there's a four ways where the heat is lost from the body. That is through the conduction. See, where the babies are kept normally in the government hospitals, we are seeing the babies are kept on the Macintosh, the babies are kept on the tray, or the babies are transferred to the research stations, and where the object, where the surface where the babies are lie down, put on down, if it is cold, the babies can get the heat can be lost, because the baby is touched to the cold surface, or the baby is filled with the amniotic fluid and it's warm, but when it is touched to the environment on the table of the babies, so the heat is lost to the conduction. Okay. And radiations, when there is a baby's heat loss through the windows, or the drafts are there where the heat can be takes place. And if the cold air in the ICUs, NICUs, in the labor room, if there's a cold way, the cold air passes to the babies through the convection, the heat is lost. And the body, the cold wet body, when it is exposed to the environment, to the evaporation, the heat is lost. These are the four ways the babies can lose. And in the next slide also we can see how the baby's mechanism of heat is lost is that so the conduction due to with the cooler objects, as I said, due to air current which is passes from the baby's body surface area, and evaporation as the babies come they are in touch with the amniotic fluid from the baby's skin, and when there is no amniotic fluid surrounding them, and if it is exposure, the babies through the evaporation, the heat is lost, and the heat is lost to the colder objects like the windows, drafts, which is around to the babies or to the wall of the babies where the cooler surface is there. It can the heat is lost through the radiation mechanism. So these are the four ways that heat is lost. So the first one is conduction, convection, evaporation, and radiation. So what are the four ways? Through conduction, that is a cooler object where the baby is lying down. The convection, the heat is lost to the air, cold air passing to the baby. Evaporation and radiation. So these are the four ways the heat is lost. Now we can see how the heat is production. Now the well flexed baby, if the baby is well flexed, the surface areas is decreased, the heat is we can conserve the heat. The vessel constructions are there. Vessel constructions is a narrowing of the vessels. Brown fats, okay, this is very important. The baby should have a brown fats, and it can helps to decrease the heat productions. And other organs, the major organs which plays important role in the metabolism, so the heat loss can be minimized and heat production takes place with this organ like heart, liver, brain, and kidney. So these are ways that how the heat can be produced and it can be maintained. Now let us understand how the maintenance of body temperature in newborns takes place in the two mechanism or two ways. When the baby is crying, the limb movements takes place and the heat is produced. The other one is that metabolic thermogenesis, that is a brown fat. This is called as a non-shivering thermogenesis. Now, the brown fat is very important in mechanism of the heat production in the newborn. So the babies who have the babies having the brown fats, there is less chance to get the hypothermia. The brown fats are mostly laid down mainly in the third trimester of pregnancy, and it is mostly located in the nape of the neck, axilla, interscapular region, groin area, and around the kidneys and adrenals. So these brown fats are very essential for the newborns because this non-shivering thermogenesis will prevent from the heat loss. The brown fat is metabolically very active and is very response to deliver or release the non-epinephrine. And non-epinephrine is helps to decrease the coldness and it provides a warmness. So brown fats metabolically plays a very active role to as it stimulates the non-epinephrine to release the warmness in the baby. The blood flowing through it to the brown fats, it becomes warm and the heat is distributed to different parts of the body. So these are the very much important mechanism. It's a non-shivering thermogenesis which helps to through the brown fats, the mechanism heat is produced and the baby feels warmness in the body. So are you getting this? Is the main how the body is maintained its temperature with the help of the brown fat. Okay, so we'll see what is the effects of hypothermia. If the baby is having a hypothermia, the body will be pale and mottled skin. The there will can be a persistent acrocyanosis. Okay, the acrocyanosis is a central sinuses. Okay, we can see that body, the extremities are blue, the faces are blue, but the trunk is pink. Then there is a respiratory distress, apnea, bradycardia, lethargy. The baby feel the lethargy, and there is poor muscle tone. Baby have a very weak cry, and there will be very less sucking, or there will be very poor sucking. So there will be pale skin. Persisting acrocyanosis is the effect of hypothermia. There can be respiratory distress, and baby will have a cessations of oxygenation. Pulse, bradycardia, the pulse rate will be less than 60 per minute. Baby will feel very lethargic, very tired, and there will be poor muscle tone and weak cry. So these are the harmful effect of hypothermia. With knowing the causes and risk factors and the mechanism of hypothermia, we can see the clinical features of hypothermia. The baby will feel uncomfortable, restlessness, and may cry. The baby will make cry, and the cry will be very pitch low. And when we touch the feet, it will be cold. It will be acrocyanosis, the bluish of face and the extremities. The baby will have a poor feeding, poor sucking, sluggish, inactive, poor suckling, and weak cry. In a severe conditions, we can see the baby is very lethargic, slow, shallow, irregular breathing will be taking place, and the baby go into a bradycardia. There will be a bright red face and extremities, and the baby can lead to a scleroma. Hypoglycemia, metabolic acidosis, and generalized internal bleeding and respiratory distress is the another other sign and symptoms where the baby can lead to the clinical sign and symptoms that can lead to due to hypothermia. That is, the newborn can get hypoglycemia. There can be metabolic acidosis, generalized internal bleeding, and that is called the coagulopathy. And that's the reason in this condition we give a vitamin K as a therapy. Okay, that because one of the signs and symptoms that generalized internal bleeding takes place. There's a coagulopathy. That's the reason most of the physicians advise in a hypothermia vitamin K is administered, and respiratory distress is the sign and symptoms of clinical features. Now we can see there's a various methods as we are today's topic is how we can prevent hypothermia. Okay, so the methods of preventing heat loss, the heat loss can be prevented. As we seen how the heat loss is taken place by the four mechanism, there is a way where we can prevent the heat loss. These are the 10 commands, or it is called as a warm chain. In most of the papers or most of the government exams, they ask the short note on the warm chain. So my dear students or my dear participants here, let us understand what is called a warm chain. The warm chain is the delivery should be conducted in a warm environment, that is 25 degree, more than 25 degrees centigrade. the babies who are upgar score is low, they should be resuscitated in under the warmer. There is a radiant warmer. There is should be taken at the warm environment or under the radiant warmer. As soon as the baby is delivered, we have to immediately dry the baby with a pre-warmed clothing. Baby should be transferred to the mother's, okay, out the abdomen, so that the skin to skin contact takes place and the heat is prevented. As we say in the government's the BFHI, we have to start the breastfeeding within the half an hour. So as soon as you start the breastfeeding, baby starts getting the nutrition, and the baby's warmness is felt by the mother's body, and the prevention of weight loss takes place. When the babies, most of the government hospitals see there is no proper clothing. If you just see the cloth is not dried proper, the mummification, is not done properly. So there should be appropriate clothing, and the bed where we are keeping, there should be the temperature should be normal. So the clothing and bedding is very important. Appropriate clothing should be there for the newborn. And wherever we can possible, we are, the babies babies peeing, babies crying, babies active in moving, and babies having doesn't have any other complaints, the baby can kept to the mother, transferred to the PNC, and always see that there should be roaming, that the mother and baby should be kept together. If any possible, the babies need to be transferred from one place to the other, the baby can be transferred with a warm transportation. Okay, we're going to learn about the warm transportation in my next slides. So how the baby can be transferred in the warm scenario. Then always the 10th important components of warm chain is, always there should be training and awareness, as we are also going to the online session. So this training is very important, that to make the healthcare workers to get aware about the how to prevent the hypothermia in the newborn. So let's see how we can prevent the hypothermia. Okay, so the first, what is to be done in the labor room? As I said, there should be separate area for resuscitation. If the baby is born and the baby is not crying, baby is just one second. Hello, I'm just sorry for the disturbance. Keep the delivery room that is should be more than 25 degrees centigrade, as I'm saying, free from draft. See, there is a, in a small hole, if the windows are there, from there the cool air can come. So always see that the drafts are covered properly with the paper or with the sheets and all. So the draft should be covered where the holes are there in the room, it should be covered properly. Turn on the radiant warmer 20 to 30 minutes before the birth. If you know that the baby is accepting the with the partogram and or basing the baby is going to get delivery, we should keep the radiant warmer pre-warm with the 20 to 30 minutes before. Then we have to receive, you can see the towels are there on the tray, that the towels which are wrapping the baby, it should be pre-warm. Okay, we should not take from the cupboard, and we or whatever, we can take the cloth and we can warm, we can cover the baby, but it should be pre-warm. It's very important that baby, newborn baby should be covered with the pre-warm sheets. As soon as the infant is born, dry immediately and remove the amniotic fluid from the body, and the wet cloth should be removed, and then next other cloth can be taken, and we can wrap the baby, or we can mummify the baby. Then cover that in the warm blanket and keep the baby to skin contact. Encourage early breastfeeding. It's very important to start the breastfeeding. And avoid, previously there was a process in most of the place, as per the hospital policy, the bathing was taken to remove the Varnish case was amniotic fluid, but now it is avoided. We have to postpone the bathing process. Okay, so this is the how we can prevent the hypothermia in the labor room. Now next, we can take the help of the other way we can prevent the uh, this occlusive plastic wrap is through the, thank you, sir. Okay, used for all the babies, okay, less than 32 weeks of gestation of the baby's age. So we can use also plastic wrap. You can picture, you can see the plastic wrap is there, so where we can prevent the hypothermia. Cover the preterm baby with this plastic wrap immediately after the birth without drying, and reduce the evaporative heat loss. As I told you, the fourth mechanism of heat loss, the evaporative process, that is amniotic fluid heat loss, which I was explaining you. So this occlusive plastic wrap can help to reduce the heat from the body, and it allows the radiant heat delivery. It also improves the NICU admission temperature of the preterm baby. Okay, so this is the another way how we can occlusively plastic wrap can be helped to prevent the hypothermia. I was discussing in the previous that there should be a good transportation. The babies can be, there is many reasons that babies transported from the labor room to NSO, and some conditions where the babies are having a dyspepsia, the babies having not taking breath properly, there can be hypoglycemia, any congenital illness, and also any conditions which the babies are need to put into NICU, or some procedures we could do to the other hospitals where the transportation is required. There should be a warm transportation. It means that continue the morning before the babies go transport, we have to check the temperature. If the temperature is within 36 to 30, 36.5 to 37.5, then only we have to transfer the baby. If the mother is going with the child, let's start, let the mother carry with the kangaroo mother care, or the father is available, we can give the father mother KFC. The warm humid oxygen should be administered. If the baby is required oxygen, if the respiratory level is low, we have to give the warm humidified oxygenation. Continue breastfeeding or feeding if it's available during the transport, breastfeeding or gavage feeding we can give. Ensure warm transportations wherever necessary. And for the preterm, we can transfer with the help of the incubator. Whether in the incubator, the radiant warmer is available, where the warmer is there, the baby can be kept and can be transferred from one place to the other place. Now, in incubators, always prefer that a radiant warmer for preterm babies more than less than 32 weeks of gestation. There are two modes we can keep the radiant warmer, that is air mode and the servo mode. The air mode, the temperature of the around environment, the baby is to be set. Okay, what are the temperatures around the baby to be set? And in servo mode, the desired skin temperature is to be set, that is from 36.5 to 36.8. And most of these servo mode baby, the sick babies, are kept in the incubators. So these are the ways how we can put in the various aspects that we can see in the radiant warmer, we can see in the delivery room, we are seeing in the how the babies. So next we are going to see how the babies can be take care into the postnatal ward. In the postnatal ward, sorry, in the postnatal ward, keep the PNC room warm. Change the wet cloth if the baby is past the urine, or the baby's cloth is wet due to some other causes. Then you have to change the clothing. Cover the head and extremities. If you see the baby, the baby is covered fully. So cover the head and the extremities with the appropriate clothing. Mummify the baby properly. Wherever, if the very cold climate is there, you make a use of socks and mittens, and nurse the mother and the baby in the same bed. That is, the mother and the baby should be kept close to close, and appropriate clothing should provide, and skin to skin contact to be done. So these are the ways that the take care to be taken in the PNC. Other cases, keep the windows closed and fans off. Continue breastfeeding. Postpone bathing in full term normal babies till second half of the life. Avoid for several days in winter. In sin babies, we should avoid no bathing. So these are the ways we can postpone the bathing. In the full term baby, we can keep the bathing on the second day in summer, and avoid for several days in winter. And in sin babies, we should not bath. In our terms, preterms and lower baby, when cord falls, or preferably till the baby gains a weight of 2.5 kg, the baby can be bathed with a warm water. Quick, whenever we're taking the process of bathing the newborn, it should be very quick in, quick out, and dry immediately. So we can see I can see the bathing steps of procedures in the next slides. Another way we can, you all know about the KMC, that is a kangaroo mother care. In some places we can give a kangaroo father care also, where mothers are in the ICU, or some mothers are LSCS and all. The father also plays a vital role. So it involves placing the newborn infants in close to skin contact with the mother. It is indicated in all babies less than 2.5 kg and who are hemodynamically stable. The kangaroo mother can be given. It is recognized as effective way to meet the baby's needs for warmth following the baby birth and in the immediate newborn period. It is also an important method to prevent hypothermia during the transport. Many of the researchers have proved, and many of the NICUs hospitals are following this kangaroo mother care. The concept, maybe you know, and maybe in the previous sessions also, most of the speaker had spoken about the kangaroo mother care. So the KMC, the baby is dressed in a cap, socks, and diaper, and placed in skin-to-skin contact with the mother, who wears the front open, comfortable clothes. Allowing the warmth, she also can stimulate the breastfeeding, thereby preventing the hypoglycemia and sepsis in the baby, and it prevents also the apnea. So you see, we have seen the complications that the baby, because of hypothermia, the baby can go into hypoglycemia and apnea. So KMC will help to prevent this two important facts, that it can prevent hypoglycemia, the breastfeeding is given, and that can be minimized in the apnea level also. So these are the ways the kangaroo mother care is given. Place baby in these positions, okay, where the front clothes of the mother is open and the cap is done, and even you can see the how the mother is feeding with the when during the KMC. Now we have seen the management, how to prevent the hypothermia. These are the various three ways we have seen: the cold stress, the moderate hypothermia, and the severe hypothermia. How we are going to manage the cold stress? I told you the cold stress is the extremities and the trunk. Okay, any of the things if the extremities are cold and the trunk is warm, it's a cold stress. So during this cold stress, we have to cover the baby adequately, remove cold clothes and replace with the warm clothes, warm room, and take the measure to reduce the heat loss. Always ensure skin to skin contact with mother. If possible, keep next to mother. Now, during this phase of cold stress, we have to check the auxiliary temperature every 1.5 hourly till it reaches to 36.5 degrees centigrade. If the baby is maintaining the temperature about 36.5, then we have to check 1 hourly till 4 hours, then 2 hourly for 12 hours, and thereafter routinely we check the temperature 3 hourly. So these are the ways how we're going to monitor the baby's temperature in the cold stress. Okay. So in mild hypothermia, how we are going to manage? In here also we have to remove the cold clothes. KMC can be provided with skin to skin contact. Keep the room draft free. Continue breastfeeding. Hot water bottles can be placed away from the baby, and we have to monitor the temperature. We have to check the CRT level, apnea, and hypoglycemia. We have to treat this. We have to monitor, and also we have to treat the hypoglycemia, and we have to take care during the mild hypothermia. In severe hypothermia, a moderate to severe hypothermia, we have to rapid rewarm up to 34 degrees centigrade, remove the cold clothes, we have to keep the baby in radiant warmer, monitor the temperature, check the oxygen saturation level with pulse oximetry, and give the oxygen supply to the baby. If the oxygen saturation is low, we have to check the CRT, capillary filling time, and we have to check the blood sugar level, because the baby may go into hypothermia, also hypoglycemia, and we have to give appropriate like dextrose. We have to prevent the hypoglycemia. We have to give the supportive treatment. Then we have to provide heating lamp or hot water bags or angati. So the ways what we provide the warmer to the baby, and possible KMC is to be stabilized when the baby is transferred to the higher center. So this is the way the various treatment is taken place in cold stress, mild stage, and moderate to severe hypothermia. How the babies are treated with the hypothermia. Are you getting? Are you following what I'm saying? It's very important, and in this all steps you have seen, it's an important role that nurses plays a vital role to give this to prevent the hypothermia. Now the supportive treatment, as we tell, we discuss, we have to prompt detect the treatment of hypoxia, hypoperfusion, and hypoglycemia. To prevent this, we have to administer dextrose infusion of 6 to 8 mg per kg per minute. To prevent this hypoglycemia, we can give dextrose. Then we can, for the fluid management, we have to get renal lactate or sodium ns, that is 20 mg per kg over 5 minutes, and we have to administer oxygen and vitamin k. As I told, vitamin k helps into places of coagulopathy, we have seen the conditions. So here we have to give the supportive management. Okay, so as the temperature is maintained, we have to monitor the temperature every 2 hours for 3 hours after the keeping the radiant warmer. If increased by zero point 0.5 per hour, continue 2 hours till normal, then 3 hours for 12 hours we have to check the temperature. If not adequate heating technique is required, then we have to, if the baby is not with the heating technique also, the baby is not maintaining the temperature, then we have to suspect that baby is having the sepsis, and then you have to treat the by antibiotics, we treat the sepsis. Temperature regulation nursery, we have to keep the baby in the overhead radiant warmer, warm the room, conquer mother care, and air heated incubator is kept into the various NSV levels. Now, as we discussed the bathing, the bathing is very important. Most of the hospital policy, the bathing is not given, but most of the hospitals they practice. But the timing, and we have discussed, the baby should be 2.5. The umbilical cord should be fall on. We should not give to the bathing to the sick babies. In term baby, we can give to the next day. The procedure is warm the room, warm water, very quick, very gentle, dry quickly, wrap the baby after the bathing, and use cap and keep close to the mother. So this is the way how we can be keep the baby the room temperature. Warm water should be there. After the bathing, you should dry very quickly, thoroughly, dress warmly. The cap, whole clothes should be the child should be very much well mummified should be done, and the baby should be kept to the mother's side so that breastfeeding should be initiated. So this is all way that we are going to how we're going to correct. We're going to say how the nursing management can be taken. Okay, so the prompt and effective nursing management is crucial to prevent the further complications. We are going to say further complications, and there can be a respiratory distress, metabolic instability, or even death. So nurses plays a vital role. So these are the 5 important nursing diagnoses. Hypothermia related to inability to regulate body temperature, exposure to cold environment, that is inadequate clothing or drafting areas, as evidenced by axillary temperature below 36.5 degrees centigrade, cool skin, cyanosis, lethargy, possible poor feeding, or increased respiratory rate. The second diagnosis, ineffective breathing thermoregulation related to immature thermoregulatory mechanism, increased body surface area, and environmental exposure. 251. Okay, I'll be a little bit speedy. Okay, so we all know these are the nursing diagnosis. The next nursing diagnosis, the risk for impact, risk for impact skin integrity related to prolonged exposure to cold extremities, cold temperature, dry and cracking skin due to the low body temperature. The risk for imbalanced nutrition less than a body requirement, because the babies are difficulty feeding, low sucking, they're poor sucking, and there is a due to cold stress, and as evidenced by poor feeding, lethargy, weak suck, and reduced weight gain or failure to thrive. Uh, the nursing intervention, we should monitor the signs, vital signs, and temperature. At least I said temperature every 30 minutes we have to check. We have to check with the auxiliary. We have to monitor the heart rate, respiratory rate, as it's very important that baby can go into respiratory distress or bradycardia. Oxygen saturation to be monitored, and we have to, according to the levels, according to the parameters, we have to treat symptomatically. Then the second one is provide immediate warmth and prevent further heat loss. For that, initial interventions should be done, that is skin to skin contact, ensure warm environment, dress the newborn appropriately, okay, by proper clothing, by blankets and all. The baby should be covered up. Use warming devices. Okay, there's various warming devices we can use, and we can prevent the heat loss. Monitor and maintain the oxygenation. It's very important that the oxygen, if the baby is going into respiratory distress and saturation is low, we have to provide the oxygenations, humidified oxygenations we have to provide, and we have to monitor the respiratory distress as grunting, flaring, and chest retractions. And wherever we can see this, we have to give a appropriate treatment. The prompt feeding and nutrition, as the babies have poor sucking and all the weeks, we have to identify and we have to give appropriate initiate for the feeding, and we have to enhance the suckling ability and prevent the further heat loss, and we have to give the appropriate feeding to the baby to give a appropriate feeding to the newborn and maintain the nutrition status of the baby. Now, monitor for complication and address the skin integrity. There's various ways the baby's skin integrity can be lost. We have to inspect the baby's skin, particularly in the extremities, because acrocentesis can take place. Protect the vulnerable skin by avoiding direct contact with the cold surface, and ensure the baby is promptly bundled or insulated at various ways. Now, provide emotional support for the parents, give psychological support to teach mother about the skin to skin contact. Okay, so and this is the very much these are the various aspects what we have seen, that we can take the care of the baby, how we can manage the babies with the various conditions, five nursing diagnoses we have discussed, and the nursing management. There are a few researchers which says that how hypothermia can be prevented, what is the nurse's role, and how the nurses plays a vital role in NICUs, or there are various studies had done. And this study says, the first study is that the effectiveness of early, where if you manage the we have seen that, okay, we have to give the radiant warmer, we have to deliver so and so. If the thermal management is very properly, we can prevent hypothermia. So here 150 newborns were identified as to prevent from the hypothermic condition, and the results, the study says that, okay, immediate interventions have an thermal support in the first hours of life can prevent the long-term complications of hypothermia. So this study is conducted by Braun, Harris, and Miller in 2022. The study says that, okay, proper early thermal management can prevent the complications related to hypothermia in the newborn. The second study is the nursing interventions in preventing hypothermia in newborns in the delivery room. We are seeing the how can maintain the hypothermia in the delivery room. So the author Thomas and Anderson and Zhang in 2021 conducted the research, and among the 200 deliveries, they are mostly focused on the temperature regulation practices in the delivery room. The study found that if the pre-warmed blanket or delayed bathing or maintenance of the warm ambient temperature reduce the incidence of hypothermia in newborns. The results emphasize that critical of nursing staff is very, so I said, there's a critical role in nursing staff, NICU, PNC, ANC. The nurses are very much, they should be trained not only in hospital scenario but in the PSC, in the rural area. They should practice. Okay, the good practice skills should be there. Effective practice makes the decrease in the mortality and morbidity rate due to hypothermia. So the another study, the impact of hypothermia on newborn outcomes in the NICU. This studies suggests that the author recommended that there should be standardized protocols related to hypothermia should be made, and it should be placed everywhere where the nurses can see the protocols and they can manage the hypothermia. They can prevent the respiratory distress, increased length of stay in the hospital, and delay in feeding. This can be minimized with the proper rewarming interventions by using the babies were kept in the incubators, and warm intravenous fluids were given, and the study has a good outcome. The fourth study is the early recognition and management of hypothermia in pediatric emergency care, which was conducted by Smith, Thompson, and Anderson. The studies advocates that implication of training protocols. See, there are many education setting like we have providing, but here the training protocols was conducted among the emergency staff to recognize the hypothermic symptoms. As the baby healthcare workers recognize the symptoms of hypothermia, they can faster give the early detection and early treatment they can give, and they can have a better outcome by giving a proper appropriate interventions to prevent from the hypothermia, okay, from the heat loss. Last but not least, the skin to skin contact. Many studies are done related to KMC, and this skin to skin contact had low cost, highly effective interventions for preventing the hypothermia in the preterm babies. So the role of the nursing in the prevention management of hypothermia in UK. This was my topic, and related to this, a study was conducted by Williams and Linger. This study suggests that the 50 neonatal nurses were assessed the knowledge and practice regarding hypothermia preventions. The study suggests that structured education and training for nurses on the latest guidelines for managing the newborn and hypothermia could improve the care outcomes and reduce the incidence and complications. For my today's presentations, I taken the reference from NNF National Neurological Forum WHO guidelines. There are 3 4 more guidelines was given under the National Indian Academic of Pediatrics. With this important things contain guidelines, we can study, we can prevent the hypothermia. That's what has gone through the condition content. And by presenting many things were similar, but we have to know that the nurses have to keep update of the knowledge with nurses. So we can, there are very small, okay. So is it, there is a 5 minutes for me, madam?
Yes, sir.
There are 2 slides or more. I
Yes,
can
sir. Yes,
come.
yes, yes.
Is it I'm going too fast? I don't know because of the time. Okay. So hyperglycemia, hyperglycemia can be, we have to prevent hyperglycemia because what are the complications hyperglycemia? We have seen the respiratory distress, cardiovascular instability, acidosis, metabolic acidosis can be taken place if you're not taking the complication. Babies can get sepsis. We have seen in the management. Poor weight gain and feeding problems are there because poor sucking is are there. Babies, babies can go prone to get the jaundice, okay, because of the cold stress. The baby can go, there can be organ dysfunction, CNS, there's a neurological improvement, and forced bite also can be taken. Say the skin integrity, the complication takes place in the hypothermia. So as we see in hypothermia, the other side is the hyperthermia. The temperature is more than 37 degree, 37.5 degrees centigrade. This takes place when the environment is too hot or for baby, overdressed baby in a hot or humid climates. The baby are close to fire or heater or hot water bottle, direct sunlight or parked car in a hot weather, the radiant warmer or incubator not working properly. So if the that prop which is keeping it is not properly and it is exposed to sun rays, radiant warmer care, it is not taken proper care, sepsis in some conditions can cause the hypothermia in newborns, and it should be ruled out in all the cases and preventing hypothermia. The signs and symptoms are restlessness, crying, then lethargy, tachypnea, tachycardia, skin is hot, excessive heat, increased metabolic rate, dehydration, shock, convulsions, and baby can go into coma, and there can be neurological understanding and partially or partially or fully breastfeed frequently or give the fluids by tube, or examine for infection and bathe with the warm water only. And that is very much advice in the for the infants. This was all about the today's sessions. We can conclude hypothermia in a newborn is a critical condition that can lead to severe complications such as hypoglycemia, respiratory distress, cardiovascular instability, and neurological damage. Early recognition and interventions are likely to prevent these complications. We have seen there are, as we early recognize by the skin touch or by the temperature properly. Okay, the nursing interventions like skin to skin contact, radiant warmers, maintaining the warm environment are essential for managing this condition. By ensuring timely treatment and monitoring, healthcare providers can reduce the risk fact associated with hypothermia and can improve the outcome for newborns. This, by highlighting this importance of prompt care and prevention strategies in NICU, we can treat the hypothermia, and it is a nurse's role. It's a nurse's interventions. Nurses nowadays are very much demanded, and they should be skilled, they should be updated with, there are many studies, and one of my colleague also had done the studies on nesting. I remember I had done a study on nesting. It was also very effective study. So we have to keep update and we have to contact many researchers, and that can be useful for the nurses around in very hospital scenarios. The evidence based practice are practice. The initially I would just remember where we used to send our students, they used to not practice game C, but when many studies had proven and there was evidence based practice was done, that NS was started and the effect was good. So nurses should not only do the routine activities, they should see there are various evidence based practice related to an ICU scenario, the neonate scenario. We should practice the research based, and should continue with the update of the knowledge. It's very important. So with this conclusion, I conclude my topic today. I hope I was too fast, but due to time constriction, I have to complete the session. Thank you so much. Thanks to Professor Dr. Uh, OT ma'am, Dr. Vaishnav Jadhav ma'am, for giving an opportunity to deliver this session. Madam Arunima Srilata from the Department of Child and Nursing, she had given opportunity to me to give a topic on this topic. I think that can justify this topic, and all the members of Bharati Vidyapeeth College of Nursing, Mumbai, for giving opportunity. Thank you, participants, for peacefully listening to the topic. I don't know you listen, but I hope that you listen. May this session is effective for you. Thank you. Thank you so much. Thank you, ECHO team, for giving this collaboration session to Bharati Vidyapeeth. Thank you.
Thank you, sir. Thank you for the like
Thank you,
detailing
sir.
of the topic.
Over to you, ma'am.
Thank you for the detailing of topic, sir. It was fruitful and nice session. Even you have included evidence-based practice. That was really like appreciable, sir. And it was very nice session, extensive session. Sir, can we start with the case presentation, sir?
Yes, ma'am. Yes, ma'am.
I invite Miss Rituja Rane, first year MSc nursing student of Bharati Vidyapeeth College of Nursing, Navi Mumbai, to start with the case presentation. Participants, if you have any doubt or anything to discuss, you can directly unmute yourself and you can discuss with the resource person, or else you can message in the chat box if any doubt or anything to clarify. Rituja, will you able to share the slide? Hello,
Hello.
will you able to share the slide?
And look- Good afternoon, ma'am. Can you please share the slide of Rituja? She is unable to share from here. Can you share the slide, please? पण मला दिसतच नाही ना स्लाइड.
Is it visible, Rituja? Rituja, is it visible?
Yes, ma'am. Yes, ma'am. It is
Start. We can start.
Hello.
Hello. Are
Hello.
you're audible. You can start.
Okay.
Uh,
Okay. Good afternoon, ma'am. For giving me the opportunity for presenting the case. So, my case. Next slide, ma'am. So my case diagnosis is hypothermia and low birth weight. So we'll see the case. The baby of X, 37 weeks, 2 days, 2 days, with a with a birth weight of 2.2 kg, delivered by LSCS, by 28 years old female patient, female, gravida 1, para 1, and living 1. The name of the patient will be the baby of X, age 1 day, gender female, date of admission 11th of Feb 2025. Baby came with the chief complaint of low body temperature. So on that basis, the diagnosis is made hypothermia and the low birth weight. Next slide, ma'am. So there is no any significant past medical history. Even there is no any history of surgeries. In a family history, there is no any significant history like cancers and all. In prenatal history, we come to know there all the prenatal checkups were done. The mother has taken all the TT vaccination. She was on the iron and folic acid supplement throughout her pregnancy. The prenatal period was uneventful. There is no GDM or PAH. No any other complication was present. On a physical examination of baby, we check and we recorded the vital signs. The temperature was 91.8 degree Fahrenheit. Heart rate was 124 beats per minute. Respiratory rate was 32 beats per minute, and SpO2 is 96% on a room air. In general appearance, we checked the skin color was slightly bluish. Vernix caseosa present and lining also present. There is no any birthmark. On a checking in a reflexes, we saw the sucking reflex and a moro reflex was slightly weak. Even a grasping reflex also was slightly weak. Apgar score we checked on a first minute 5 by 10, and even and other on fifth minute 8 by 10. In a systemic examination, we come to know in a respiratory system there is a slightly breathing difficulty was present. The respiratory rate was 32 beats per minute. In intugumetry system, the low body temperature and slightly peripheral cyanosis was present, and the cold and extremities were cold, and all other system were appears normal. In diagnostic evaluation, we check the temperature 91.8 degree Fahrenheit. Blood sugar, we checked 60 mg per dl, and also check the CBC and serum electrolyte, where the all values were normal. In nursing assessment, we checked the vital signs and recorded. Temperature was 91.8 degree Fahrenheit. Heart rate was 124 beats per minute. Respiration was 32 beats per minute. In anthropometric measurements, height was 48 centimeter. Weight was 2.2 kgs. Head circumference was 30 centimeter, and chest circumference was 28 centimeter. In skin, the cyanosis present and the peripheries are slightly cold. In respiratory system, slightly breathing difficulty present. Respiratory rate is 32 beats per minute. In cardiovascular system, S1 and S1 and S2 sounds were heard. there is no normal, and heart rate was slightly checked in GI system. No any abnormal deviation found on in our treatment and management. Thermoregulation, for the thermoregulation, the baby kept under the radiant warmer. For the slightly breathing difficulty, we administered the 2 liters of O2 by the oxygen hood, and KMC was advised for the baby, for the mother. In after the doing after nursing assessment, the nursing diagnosis is made: ineffective thermoregulation, hypothermia related to environmental change as evidenced by baby body temperature was less than normal. So the uh, short term goal is made. The baby will demonstrate a normal body temperature which is 98-degree Fahrenheit, and long term goal uh, long-term goal was baby will able to maintain a normal thermoregulation process within a limit. In the care is given, like care we give to the baby is like monitor baby temperature hourly, baby kept under the radiant warmer, maintain the warm and comfortable environment around the baby. Baby always we kept the baby always dry and wrapped, and for the lack of O2 consumption, we provided a oxygen, and for any further complication, we did a ABG. On the after giving 4 hours of nursing care, the evaluation is made after 4 hours of nursing care. The baby body temperature increase to the normal, and the follow-up and prognosis: monitor the baby temperature second hourly, maintain a body temperature with a warm clothes. Parents are advised to watch a sign of low body temperature, poor feeding, and peripheral cyanosis, and follow up with a doctors if concerned. Prognosis: in a most cases of baby with a hypothermia has a good prognosis. In this case, the baby temperature improved in a 24 hours, and the breathing pattern also stabilized. On day 2, baby was shifted to the mother from the NICU, and on the day 5th, which is the 15th of Feb, baby got discharged from the hospital. So the challenges faced in this case: the maintain a normal body temperature, ensuring the baby body remain dry and provide a heat loss barrier, provide a warm environment to the baby, providing emotional support to the parents and uh, families, and monitor for the complications are should very vigilance in a monitoring of potential problems such as the further infection and tachycardia, tachypnea. Nursing management, health education is given. First, we about the temperature and environment. Keep the baby dry and tightly wrapped in a blanket. Breathing and respiratory care: observe your baby's pattern. Watch for a sign of difficulty such as the breathing, rapid breathing, chest retractions and all. Feeding and nutrition: breastfeeding is highly encouraged, as it help in a strengthen the immunity and improve the recovery. Medication: all the medicines are necessary. Do not stop any medicines without any doctor's order. Ensure a regular pediatric checkup to monitor the baby temperature and low overall growth. Follow up with a body weight monitor as any additional test if recommended. Vaccination should be given as a schedule to protect against infections. Thank you, ma'am.
Thank you, Rutuja. Then, sir, okay, so the feedback message will be given to you in the chat box as well as in the WhatsApp group. Please complete it. So feedback form is very much necessary to complete for your certification and even your attendance for further sessions also, please be on time and join on proper time. The next session will be on Friday, that is 7th of March by 2 p.m. So see you on Friday. Thank you, everyone. Kindly complete the feedback.